Our expert panelists joining us today are Dr. Richard Palmquist, Integrative Veterinarian and owner of Centinela Animal Hospital. He's an author, lecturer, and teacher. Dr. Christina Chambreau, internationally known homeopathic veterinarian, lecturer, and teacher. Joan Ranquet, animal communicator, teacher, author, lecturer, and owner of Communication with All Life University. And Brendan Golia, professional pet trainer, behavior expert, and owner of OC Canine Coaching. Welcome to Smart Pet Talk. I'm your host, Anna DeVere. In this special episode, we're thrilled to welcome Dr. Madeline Yamate. Dr. Yamate is a distinguished veterinarian, certified in veterinary acupuncture, Chinese herbal medicine, Chinese food therapy, and Tui Na. She has extensive training in veterinary spinal manipulation therapy, manual manipulation, applied kinesiology, and bioregulatory medicine. A former faculty member at Chi University, she's taught in Florida, California, and Spain. In 2023, she was honored as a charter fellow of the American College of Veterinary Botanical Medicine. Dr. Yamate lectures internationally on traditional Chinese veterinary medicine and holistic veterinary medicine. She practices at the Center for Integrative Animal Medicine in Davis, California, and is president of the American Holistic Veterinary Medical Foundation. Welcome, Dr. Yamate. Thank you so much for joining us.
Thank you for having me. I appreciate it.
Doctor, we're going to discuss traditional Chinese medicine today, and I'm guessing this term may not be as familiar to some of our viewers. And I've read that this form of medicine has evolved over thousands of years and that it addresses various psychological and or physical approaches. Could you just tell us a little bit about what types of therapies are used in traditional Chinese medicine?
So there are 5 branches to traditional Chinese medicine. There's acupuncture, Chinese herbal medicine, food therapy, Tui Na, which is kind of like a combination of medical massage and a little bit of maybe chiropractic maneuvers, and then Tai Chi or Qigong. So for our animals, easily acupuncture, herbs, food therapy. The Tui Na can a lot of animals really enjoy that, but we can't teach them how to do Tai Chi or Qigong. So for me, the replacement is going to be regular daily exercise and also mental stimulation, right? Because when you're doing Tai Chi, Qigong, you're doing prescribed movements with breathing, and same thing with movement imbalance, which is such a wonderful thing to do for us as we get older, but also for our animals to start making sure they move consistently.
Oh, thanks for that overview. I appreciate that.
Can I jump in?
Yes.
So I love to tell people that they want that there's animal communication, energy healing, training, management, and then holistic veterinary care. Maybe you could share with the viewers what exactly, you do that's different. I mean, I know what you do, but what's different than, say, Western medicine?
So I always have my Western medicine cap on also, right? Because you need to explain things to clients so they absolutely know what are your options. My job is not to tell you what to do. My job is to help you find what you feel is the best modality or the best treatment for your animal. So what I always look at, and to me, emotions are huge. So amongst some groups of people, do animals have spirituality is a question. For me, it is not. I do feel that our animals, there's different levels of, I don't know if consciousness is the correct term, but I always say I had a pit named Roxy, and she was just a dog, a DAWG. Whereas some of my other animals have been so highly evolved that if they could speak, I think they would be able to solve world peace, right? So we have that nice continuum. But I think for me, my job is to get the most out of that patient, is to fulfill them, not just physically, keep them healthy, but also emotionally and mentally. And what I've seen over the years are, you can have some of the most wonderful animals that find the right home with the right person who bring out those spiritual aspects of the animal out. And then you can also have an animal that, I'm like, oh my gosh, your dog is so wasted on you. And I think as we learn more and more about animal behaviors, certainly our companion animals, right? I think we're starting to realize that there is a richness to their emotional lives as well. And I think people like you, Joan, who are able to communicate with animals, who can verbalize that with people, are so incredibly helpful. I recommend animal communicators to some of my clients. Some people are skeptical, but I tell them my experiences. And even if they don't feel that what they're being told, I find it gives you another way of looking at a problem. So it might be interpretation on your part or on our part, right? So I think it's important to still try and facilitate that communication, and then know that maybe we're all speaking in a different language and trying to find a place where we all understand each other. So maybe there's some little bit of misinterpretation. So you need to think about it, and then perhaps we get to what the actual truth is, so to speak.
So actually, I want to jump in right there with truth and right answer. I liked how you started by talking about there really isn't one right way. There's no one right expert. It is unique. And even finding the truth is when you're doing, so a lot of people hear about acupuncture. They don't know Chinese medicine, but they know the word acupuncture. And more are learning the word acupressure because that's something they can do with their animals at home. But acupuncture can be done either just for a problem, use these points for a hip, or they're used to treat the whole animal by using like pulse and tongue and other. So for people listening who want to come to somebody like you who's doing Chinese medicine, what should they be looking for as they're selecting a Chinese medicine veterinarian? In addition to, and I will absolutely say this, is they want somebody who, like you, says, I care about your pet's emotions and the spirit of your pet. So you want to hear that from your vet. But in addition, what else?
I know there's some people probably like, I don't want to know. I would say acupuncture is evolving, right? Along with, there's a different wave of acupuncture where it's called medical acupuncture, and they're using scientific research, scientific basis to enforce what they feel are valid and effective acupuncture treatments. That I don't do, but do I use Western biomedicine in my acupuncture? Absolutely. We are taught that in our acupuncture schools. It's just that what we learn at a place like the Chi Institute or IVIS is going to be, it's going to expand a little bit more. My feeling is when people come to see me, sometimes I get people who are referred by their Western vet because a patient may not do well on NSAIDs, right? And so for acupuncture, they'll come and see me. And so my job, in my opinion, is to explain the other things that are available to them. I do explain that I have had patients where I literally can look at them and go, you and your husband were fighting this week, haven't you? And they'll say like, yes. And honestly, I had one couple, it was the most wonderful dog that he lived an incredibly long life despite advanced disease. And I had to tell them that you two need to stop fighting, because every time I see I see your patient, your dog, and he's gotten better, and then you guys get into a big fight, I see him decline. And I said, sorry, but here's the thing. Either you need to stop fighting or break up, because you're sending this dog to his grave. And they stopped fighting. I was like, they're going to fire me, but they didn't, because they love their dog. And actually it helped the relationship, which was a shock to me. But my job is to make sure that this animal in front of me is going to have the best life possible. I would say
excellent.
Yeah, but I think different people,
should they be doing
pulse are so
diagnosis?
I always laugh. I do tongue and pulse. And what I always laugh when I was teaching students, I would say you can affect the pulse easily by how long you hold the animal, because they really do absorb a lot of our energy, right? And so what I would do is what I do is I minimally touch the animal. I don't want the client touching the animal, and I try and check things. Also, as soon as they walk in the room, I'm not going to do tongue and pulse, because they're excited, right? So the tongue is going to be darker, they're going to be panting, or their pulse is going to be faster more bounding. And so I like to check it a couple of times if I have a stressy animal. A new patient, appointment, I don't even bother doing anything. I talk to the client first, get information from them, get the animal relaxed, watch the animal as it moves around the room, and look for things that I can, build upon or ask questions, and then we move forward. But yes, if if it's a hot day, the tongue is going to be darker. If the dog is stressed out, it's going to be darker, and it might be purple, from stagnation. And so you have to look at all of those things together to put together your picture. In Chinese medicine, we talk about a landscape of clinical signs, right? And that's what I put together. I gather all that information in this, crazy brain, and try and figure out what are the deficiencies, what are the excesses, what do I need to work on. I will say, because when we're talking about how animals respond to things, I've been very fortunate to have a multitude of clients where the clients were so invested in what we were doing that literally, my joke is like, I could just look at the animal and fix things because the clients and the animals believed in what we were doing. But shockingly, I've had physical changes with needles alone that I never would have thought would have happened. For example, a DCM dog, the heart repairing at an old age, right? Also a gastric mass in the same dog shrinking. And so it's really quite profound. And I think part of that is finding the right practitioner, client and animal combination. So my greatest joy is I know so many different people who do what I do and other modalities, that if I feel a patient is not responding strong enough, I can easily contact them. Rick knows I've asked him questions before. I've texted him like, Rick, what do you do about X, Y, or Z? And so sometimes you might need the help of another practitioner to help you, guide you, or you may need to send them to another practitioner altogether.
Or if you're the client,
sorry.
Excuse me, let me just finish up. If you're the client looking and seeking for that good relationship, if you feel you aren't doing well, even if it's a super expert, you might want to say to that veterinarian, I'm going to try somebody else because it's just not fitting, or just go try somebody else and see. So it's okay to do that. Just, we should be able
to do that. I agree. I think the other thing is that you can't be so set in how you practice and what you do that you're not going to listen to what a client says, right? So for example, I have some patients that I have to be a lot more subtle with, right? Because they're older. And I have some geriatric patients that, man, you can just want the heck out of them with like strong electroacupuncture. So I can't do that with all my patients, right? So I need to modify how I behave. There's some patients that I'm a lot softer with because that's what they need. And there's a couple that are just like crazy that you have to restrain a little bit firmer. So it just really depends on the animal. So you yourself as a practitioner, in my opinion, have to be more versatile. You need to be able to read your patient and adapt your treatments. And that's going to change over time, right? Because there have been a couple of older patients that did beautifully with acupuncture. And then once they got really old, they're like, oh, I don't like it as much. And so you modify what you do.
Yeah, I think that those are all really good things. I became aware of this relationship thing with my patients a long time ago. I had a guy who worked in the Air Force, very pragmatic, wonderful pet owner, and his dog was an older dog who'd never ever had a problem, and suddenly presented to the clinic with an ear infection. And most ear infections are actually allergic problems, like 85% of them. So it's unusual to have a dog just suddenly come in with an ear infection that has never had that problem before. It doesn't swim, hasn't been groomed, all those kind of predisposing things. And I was looking at the dog and things just didn't make sense to me. And I asked him, I said, so what changed at home? And he goes, how do you know? I said, well, your dog's always been healthy and now it's got this ear infection. Is there something going on? And the guy was like, oh yeah, like the week before this started, they changed my schedule, and I've always been out during the daytime and then home at night. Now I work nights. And so the dog wasn't getting the same exercise activity, and all we did was just treat that acute ear infection and then switch his patterns around so the dog was getting walked and could adjust its rhythms, and went right back to being normal, never had another problem again. And I think it's really important to understand this idea of relationship and of community, because just because someone studied acupuncture or gone to a website, or they have a PhD from Twitter, where the requirements for a Twitter advanced degree are like read 10 tweets and then form an opinion about them as your dissertation. So if a person actually has studied, what most Chinese practitioners will tell you is that no matter what everybody else says, nobody ever masters this, because the subject really is life. And the Chinese people that developed this, the Oriental people, because people don't like calling it Chinese medicine because there were other Asian countries that were developing things. The people that were developing those were asking the same question we're asking: why are people getting sick? How can we help them? What can we do? And so we have to build these communities of competency and compassion. And in those communities, we have people who gain respect, and that word respect actually means to look again. Like, so if someone says, I have all these letters after my name, but they treat the dog and it doesn't get better, then we don't have the same amount of respect as for somebody else that just sits down, settles in, touches the dog, has something, and patients are getting well. So we have to look at the fruit as well as the credentialing, to tell if people have that experience. And that comes with time. So a new acupuncturist is just, they've learned their acupuncture points and they've learned some point pattern setups for varying Western diagnoses or Eastern diagnoses. But applying that to life gets better as they get older, just like we get better and older. So what do you think the barriers are to teaching the subject to veterinarians, to getting more professionals interested in Chinese medicine? What do you think we need to do to accomplish that?
Well, I think, as you all know, I think the acupuncture community is polarized into two camps now, right? In terms of medical acupuncture, and how it was actually created in the roots of traditional Chinese medicine or Chinese medicine, or Asian medicine, right? Oriental medicine. I would say, in my opinion, I think acupuncture and alternative modalities, a handful of maybe, should be taught at the university. There's so much evidence of the efficacy of acupuncture, and I think it benefits animals in so many ways. Whether you choose to go the medical only route, that's your decision. For me, that was not what I ever wanted to do. I'm very happy with what I do, but I think it should be part of the curriculum. When I was in school, I went to vet school, started in 2001. And there was a lecture where they mentioned acupuncture in neurology, and it was regarding seizures, right? It was just mentioned acupuncture may be helpful for. I do not recall that we had any lecture about acupuncture for IVDD, for disc. I mean, and all of us who do acupuncture know how extremely effective it can be in many cases. We all have those cases where we had a patient that was paralyzed, no deep pain at all, and then they still were able to get up and lead normal lives again. And so I think it should be part of the curriculum, and I don't know how we can get it there. I would say we have to all learn how to play nice together. My feeling is I don't ever automatically change another practitioner's treatment plan if they come to me. I'm more of a secondary, maybe even a tertiary facility. But I will call and ask the veterinarian, or I'll discuss it with the client. Like, these are things that we would do differently. It's your decision how we proceed. And I let them know, I don't want to change your vet's treatment plan. I'm not saying it's incorrect. I'm saying, for what I can offer, this is what I would like to do. So I think if we can get a greater acceptance among the Western world, amongst the Western practitioners, I think then we can have an easier job of getting it into the actual curriculum. The other thing for me is I want to drive that demand via students, right? Be it undergraduate students who are pre-vet or veterinary students now, and have them go like, hey, I saw this vet do acupuncture on these patients, and it was pretty amazing. I did that when I was a student. I would literally tell people when I was on rotation about what I'd seen. I would do it off campus, like out of the hospital, so I wouldn't get in trouble. But I was so excited about what I had seen when I had shadowed another veterinarian that's what I did. And I created classes at UC Davis when I was a student because they didn't have any. But thankfully, there are more universities and hospitals that now have an integrative service. There just aren't enough, right?
Yeah, so we're back to competency and results. So if we get results, people talk about that, and that gets more people interested. And
Correct.
I think that I would agree with you. That's how I got into integrative medicine. I went out to get a guy's license revoked, and the first thing that he did was take a paralyzed, hopeless case and get it up and walking in 20 minutes with acupuncture. And I literally lost consciousness. I fainted. And after that, I couldn't deny it anymore, even though I hated needles. I didn't want anything to do with it. But when you see that, it's like, wow. So I think Brendan was coming up with a point. So,
well, I would just, acupuncture seems to be covered by insurance and for humans now. I guess over chiropractic. Is that happening in pet insurance at all? Is there any pet insurance?
So there's some. Every insurance company is different. There's some insurance companies that. And some will automatically cover acupuncture. Some will only cover acupuncture if they have an alternative rider. Then there's some companies that will automatically cover herbs, and some without an alternative rider, and some that you have to have the rider. It's really different, and you have to do your research. And honestly, I've seen policies change midstream. So like when they renew, all of a sudden, oh, we're no longer doing X, Y, or Z. So that does become a bit of a challenge.
That can be frustrating. On a side note, we discussed a lot of medical conditions you're able to help with acupuncture. How about behavioral? How about what people are experiencing at home and people are baffled. They don't have a grasp on what their dogs are even saying half the time, but they're definitely vocalizing. They're definitely emotional. There's definitely conflict. It's inner dog conflict. It's with reactionary to the environment, whether it be fear-based or arousal-based, or is it stress-based? Obviously, it can be contributed by pain or discomfort, and so it's a whole picture. How are you able to help with pets in those cases like that?
So
what does
pain,
your
number one,
successes be? Yeah.
So it's interesting because I've actually had MDs who didn't recognize pain in their own animal. I'm like, okay, running stiff-legged, just because your dog runs to keep up with you, but it's stiff-legged doesn't mean it's not painful. And so first thing is I try and find what could be painful. I look at range of motions, which is really important, right? But you have to look at range of motion in light of age. So do I expect chronic degenerative changes in an older dog? Absolutely. So I do show them physically, like, look, your dog has very limited range of motion here, or do you feel this? This is a medial buttress. This is evidence that your dog has had a torn cruciate in the past, be it full or both. Usually it's going to be a partial, right? I also tell them that, because a lot of times people just want some miracle herb or miracle whatever. And I'm like, okay, really? If there was a miracle pill for anything, like literally, do you think I would be the way I am today? I mean, I would be able to take this wonderful magical drug that would be able to make me calm and always like non-reactive. And it's just not possible. So you have to tell them that there is a connection, right, in terms of activity and brain emotion, right? And so a lot of poor behaviors are going to be an issue of the animal not getting appropriate activity, and animal's needs not being met, right? And it's going to be different for each animal. I mean, you can't expect a dog to be left home all day long while you go to work, and then you come home and you've got to make dinner for your family, and then you eat, and then maybe you throw the ball or you toss them in the yard and it fence fights with the neighbor's dog. That's not a good mental activity for the animal, nor does it provide it with good exercise. So I really encourage my clients and tell them, make part of your treatment plan is you have to interact with your animal. If it's a cat, you play with your cat every day. If it's your dog, you've got to walk your dog at least twice a day. Even if the second walk is just around the block. Or if you can't do that because your dog is mobility challenged or you're in a rush, put them in the car with you. They love going places. Things smell wonderful in different places. So stimulate that brain. But I think a lot of it, you're correct, is that you have to educate the client because, I was raised where we got a dog and my parents would literally open the front door and let our big old German Shepherd, go run around the neighborhood. And our other neighbors did the same thing.
Wow.
Right. My world now is so different. Like my dog would never in a million years do that. So I think we have to educate people on what I guess responsible pet, ownership or pet parenting is all about. And it's going to be different in the end result. But my goal is this is what I think, in my opinion, is ideal. Where can you meet me along that continuum?
I'm still reeling from your comment that some dogs are wasted on people, because I'm sure that was true about my Chihuahua. That I really didn't deserve her. She was so smart. I mean, I loved it. And we'll say I'm a very advanced cat owner. I've had cats my whole life, and they can be sometimes hard to effectively look at their pain, because they're really good at hiding pain. I'd like to bring Joan up again at this point, though, because I think it does have to go back to animal communication, reading the signs. Joan, would you like to interject anything about that subject, about really understanding and learning to read signs, so that I can be a better pet guardian and come to somebody as advanced as, Dr. Yamate?
Well, I was just thinking about what Brendan said. Are there acupuncture points or things within Chinese medicine that affect behavior? And I do EFT, emotional freedom technique, which is, of course, based on some really incredibly calming acupuncture or acupressure points. So I would love, I would love to hear more if you do anything with your clients to kind of give them homework with points or things.
So some of them clients are willing to do, this is the interesting thing. Some clients are willing to do the homework at home, and others are like, I want you to do everything while we're at the clinic. And I'm like, that's fine, that we can certainly, if you can afford the time to come every week. To me, I think it's, I want to empower you as well. But yeah, like I'll use essential oils as well. I do use medical grade essential oils that have been tested and are proven to be safe. So I'm selective of which ones I use. I might use those as part of a massage technique, but I'll show them some points like stroking right in between the eyebrows, right behind the ears. And then some animals just don't like that, right? And some animals are happy just to be gently stroked. So I'll have them do that as well. For me, also, aside from herbs, so there may be herbs there are usually herbs that I'll use for behavior cases, and it depends upon what the Chinese medicine diagnosis is. You can't just say one size fits all. It's not like you just throw, like in Western medicine, like we're going to throw Prozac, right? Or those aren't what we do in Chinese medicine. And so for me, I have to find the underlying problem. Right? So usually if I have behavior issues, it's going to be probably about two different herbs. One to address the other thing is that there's a lot of great research on probiotics and behavior, right? Or microbiome, gut microbiome and behavior. And I started incorporating that, and I've had a couple of cases that are just outstanding with the addition of a probiotic. So I think that's a nice, easy thing to do that's specifically addressing behavior. For me, I tend to use more human products than the big animal name companies that put out probiotics. It's just been, they're very successful for me. But I would say just settling down with your animal, spending time, even if it's like 5 minutes when you're in bed, petting the animal, feeling them over. My big thing is I want to feel them over for lumps, bumps. I want to feel them for any kind of, like right now we've got foxtails. And I do find a lot of animals find that relaxing. And then to go back to the essential oils, I think the essential oils are great because humans relax with those essential oils as well. So it's a dual purpose, right? Both the client and the animal. But some animals don't like them, especially cats, right? Like you come to them, I'm like Dr. Melissa Shelton, who owns a company that makes essential oils. She's like, don't go with them with the big smelly hand. I mean, that's rude. So I'm trying to think. I'd say just feel your animal and see what is comfortable for them. A lot of animals do have a lot of neck issues also. It's like a lot of stress there. So aside from behind the ears, right here, I would also say stroke down the neck, feel for the tight spots, and then gently massage those as well.
Yeah, and you can look, the nice thing about animals is we have two, a left one and a right one. And so if you're not trained in acupuncture, you're not trained in chiropractic, you're not trained in these other things, you're all trained in like relationships, and you can put your left hand and your right hand on the body and just go, and you're feeling for differences. If one side's hot and the other side's cold, or if one side's hard and one side's soft, or one side's normal squishiness, but the other side, when you push on it, they wince. This is a lot of information to tell your acupuncturist when you go to your Chinese doctor to share that information. Like, oh, I noticed when we cut his nails, the middle nail on his left paw, he tries to bite my face off. Because these are things we wouldn't find in the confines of the exam, but they actually trigger us to look at other acupuncture points or to look at other meridians, so that we can go like, oh gosh, I think your dog has a problem in this meridian that I wouldn't have found before. And so that's really, really important. I wanted to just interject really fast because we're running out of time. But I just read a really fascinating research paper 2 days ago that they've actually identified that they think that there's a non-pharmacologic effect of Chinese herbs. And for years and years and years, we've been looking only at the plant and its chemical constituents. And now they're spreading the view a little wider, and they're actually starting to look at the normal microbiome of the plant. And they're finding physiologic activity on the dead organisms that are inherent and incorporated as part of the herbal preparation. Those dead organisms have pharmacologic effects that we attribute to the plant that are sometimes inexplicable. So I think that as we find out more and more information, the old explanations of Chinese medicine oftentimes end up being much more inclusive and actually much more accurate than the strict biochemical, neuro and anatomical studies. So as we learn that, then maybe the tribes will stop fighting and we'll all just start doing better medicine together.
Well, that's so important. I just want to underline that quickly is, again, there's no one right answer. And so you're the one living with your animals. And Dr. Yamate, when you talk about petting and feeling, I've heard that if you stroke, and I forget if it's 6 minutes or 8 minutes, if you stroke very, very slowly, that it actually stimulates the release of oxytocin, which makes the animals feel better. So therefore, while you're examining your animals, if you do it very slowly, you're adding in a whole nother layer. And just to echo, definitely Dr. Palmquist, we need to all be working together. However, there's a place for each of us, and you're the one living with your animals. And so again, if it's working, keep going that route. If it's not, try something different.
I was going to touch on one thing you mentioned about the probiotics, because I think that's something that is, it's a topic that is expanding. And we talked to a lot of guests here that are into that, and it's something that we're all into ourselves. It's confusing, like everything else, like dog food, like medicine. The information's all over the place, and it definitely still needs a lot of studies. But what I've noticed is that a lot of the pet probiotics, they don't really tell you the strain exactly. There's the substrain, I don't know what the term is, but there's the substrain or the phylum or whatever it might be, but they're not really telling you what exactly is in there. How do you select your probiotics? I know you said from human lines or from human products. Is it singular? Is it, are there 16 different strains? Do you rotate? Or do you find certain ones work better? I mean, there's definitely ones that work better for, say, like diarrhea. But as far as behavior, what have you found?
So for behavior, there's one company that I like in terms of the human line that, I thought on a whim, I tried it because the big name Western pet food company that makes one for calming. I have not honestly had great responses to their lines of probiotics. I'm really excited that they're adding a lot of different probiotics for different reasons, but in my experience, they haven't been as effective. I look at the number of strains. Typically, research has shown us that you have multiple strains of a probiotic that's going to be more beneficial. Sometimes they're saying that, that if they are refrigerated, it's going to be a better product. The one that I use is nitrogen sealed. So when you pop it open, it doesn't smell so great because I take some of their products as well. But my feeling, as I always tell clients, I go, not one product is going to be right for everyone. So we might have to try. So I carry a whole line. I carry about like 5 different probiotics in my practice, maybe 6. And then I say, this is my top one. If that doesn't work, we do a different one. And I don't follow directions for dosage. mean,
Hmm.
it's case dependent, right? So it really depends on the animal, not just the size, but what their conditions are and what their body can handle. I think that's the most important thing, is don't feel like you always have to always have to use the labeled dosage of anything. Rick and I, we both do Chinese herbs, and his patients do really well on micro doses. Mine, I'm telling you, I mean, I have a lot of cancer patients, and I want the heck out of them. And if I get them early on, we get some great responses. But I think somehow the right animals go to the right practitioner. They find us, because mine typically do great on a high dose, and then we kind of nail the cancer. I don't think I could get away with what Rick does, but our energy is different, right? And I think that affects how we practice. It affects the patients that are drawn to us, and it also affects our results. So that's why I think it's never a one size fits all. We can't just go like, hey, I read about this on the internet and I'm going to get this product and this is the dosage, so that's what I'm going to use. You have to, I think, be a little bit more thoughtful and be willing to experiment and be willing to give things a chance, and then maybe modify them.
Dr. Yamate, as a pet guardian, I appreciate everything you've brought to light. I know our panel appreciates our time with you. How can our viewers get in touch or learn a little bit more about you? How do they find you?
We have a website. It's www.ciamvet.com. I will work with veterinarians if they have a patient that wants to have a consultation. In the state of California, I can legally initiate a vet-client-patient relationship over synchronous video. I don't do that at this point. For me, what I do, I require, I need to touch, feel, smell. But in some cases, if we've got terminal diseases, perhaps maybe that's an option that we can explore. But they can also look for Chinese medicine practitioners. They can look on the Chi University website. They can look at IVAS, IVAS. They can look at AAVA, which is American Association of Veterinary Acupuncturists. They can go to the ahvma.org, which is the American Holistic Veterinary Medical Association, where there's a listing of practitioners that do different modalities. You have to talk to the practitioner. Like I don't mind when people call. I've had people who've done a meet and greet before in the past, but find somebody that you resonate with, because part of my ability to best treat your animal is if I have a relationship with you and you can be forthcoming with information. It may not have to do with your animal. It could be like, Madeline, I just lost my job and I have no money and I'm really stressed out. That gives me information, not just in terms of what things I might reach for financially, but it's going to be like, okay, what's that impact going to have on your animal? And what can we do now that if you're going to have more time, maybe I can have you do some more things at home that will be helpful to your animal. So I think that's the most important thing, is have a relationship with your practitioner. Find somebody that you can be honest and open with, because it's rewarding for both of us, and then obviously for the animal as well. So that,
I really
to me, I think
appreciate that.
The most valuable piece of information. And if your Western vet can't give you the time, maybe you need to find somebody else. Maybe that will get other veterinarians to view that there's another way of doing medicine, right? That's my hope. My goal in life is to change how veterinary medicine is practiced.
Well, we appreciate the impact you've made so far, and we appreciate this conversation. And we love to thank you. I'm speaking on behalf of the panel. Thank you so much for this. If you at home would like to be a part of the conversation, you can email your questions to our website. It's been a wonderfully informative show. And it reminds me that when we save an animal on the earth, we're not just keeping another animal alive. We are demonstrating acts of compassion, kindness, and inspiration towards a better world. We'll see you again soon. Until then, love your pets. Medical information obtained from our website or the live show is not intended to be a substitute for professional care. If your pet has, or you suspect they might have, an illness or other medical condition, you should consult a healthcare provider. The opinions expressed on this TV program are not necessarily those of Smart Pet Talk, this TV show, or their sponsors. For all questions or info on sponsorship, email us at info@smartpettalk.com or visit our website at smartpettalk.com.